The initial therapy session for clients can be kind of anxiety-inducing, right? We don't really know what we're getting into. We don't know what to expect. We're meeting some random person for the first time, and we're supposed to talk about all the things. When it comes to the first session, I think on our side, we try our best to do everything we can to make it as calm, natural, and a safe space, okay? Some of the things to expect from most initial sessions would include review of policies for our clinic, other locations. If it's a private practice, they'll talk to you about what they expect, what they're hoping to be the case, especially related to absences. Additionally, one of the things that is reviewed in, I would say 99% of initial sessions with your therapist is going to be what it means to be a mandatory reporter as the clinician in the relationship and what that dynamic can look like. Some of the other things to expect could be the therapist explaining their framework, their approach to counseling. That way you have a general idea of kind of like what to expect from treatment. For example, is the therapist, cognitive behavioral based? Are they psychoanalytic based? Like what's their approach? And that can be really, really helpful because if your therapist is able to explain, hey, we're going to talk about these topics, these are some things to expect, and then a big part of cognitive behavioral is homework. So if you're in a session with me, for example, we'll talk about, building a routine, building a schedule, and then I will assign you the task of building a skeleton schedule so that we can review that the next week when we meet again. And it can be really, really helpful to just have a general understanding of kind of what to expect and what it means to be whatever type of framework or have a certain theoretical orientation by that therapist. Some of the other things to expect could be opening the floor to questions. I know a lot of clinicians that will simply ask, do you have any questions for me? Is there anything that you specifically want to know that will help this process be smooth and as comfortable as possible? We really, really want the space to be safe and comforting. We don't want anxiety to be the sole focus or like the main energy in the room, but it is to be expected a little bit during the first session. I mean, meeting anybody new for the first time can be anxiety inducing, whether it be a doctor, a clinician, a friend, somebody in class, I think another big part of the initial session is kind of just getting a feel for each other. We'll ask you what are some things that you're specifically wanting to focus on. We can build treatment plans together. If you don't already have a treatment plan built from your assessment, that can be something that can be a big part of the initial session of what are you here for? What do you want to work on? Are you wanting to work on relationships, anxiety, stress? What does that look like for you? And that helps build like a trajectory of where you guys are going to go in future sessions. But bottom line, I'm hoping that your initial sessions will be comforting and welcoming, and anxiety is a part of it, but embrace it and keep coming back.